So welcome everyone. You're entering the Breaking the Stigma and Barriers to Mental Health Illness within the African descent and Black immigrant communities. My name is Harold Turner. I'm the Executive Director of NAMI Urban Los Angeles and also on the Board of Directors for NAMI California.
Well, welcome everybody, and thank you so much for having us here today. My name is Brenda Greatlish, and I'm the Executive Officer for the Council on Criminal Justice and Behavioral Health. And I'm joined today with my colleagues, Hallie Fader-Tao and Katie Herman from the Council on State Government's Justice Center to talk to you about a really exciting project that we've had underway and that's going to keep moving forward. We're getting some great momentum on it, and that is really working to address the housing needs of individuals with behavioral health conditions who have become involved with the justice system. Recognizing that this is an extremely vulnerable population and very desperately in need of housing and often getting left behind, and even such that maybe a lot of this justice involvement could have even been prevented in the first place, with housing being a really key component of that. So today we're going to talk to you about a recent report that the Council on State Government's Justice Center did, providing us at CCJBH with recommendations on how to go about addressing those needs. I'll start off a little bit and giving a background on CCJBH, just for those of you who might not be familiar with who we are and what work we do. And we have quite a portfolio and really get to do a lot of exciting work, but we really exist to focus on this population with behavioral health conditions who are involved in the Justice Center. So again, thank you so much for having us here today so we can really share this great information and keep this momentum on this work going so that we can address these housing needs. So a little bit about who we are. Again, CCJBH, we were statutorily put into place in 2001, and it really didn't start getting off the ground until about 2002. It was called the Council on Mentally Ill Offenders, and a few years ago we changed our name, also in the statute, to really keep up with kind of how our field is progressing. We have a 12-member appointed council. The chair is the Secretary of the California Department of Corrections and Rehabilitation, and with realignment that happened in 2012, there was also a bit of a reorganization that happened with our state departments. So our former Department of Mental Health split up into the Department of State Hospitals, and then the community side of the house rolled into the Department of Healthcare Services. So where it once was one co-chair, now we, several years ago, we split up into two co-chairs, one from each respective department. And then the rest of our council members are experts in both criminal justice and behavioral health. We have folks with lived experience. We have a school psychologist on the council. And so really a nice representation. We also have a NAMI representative, was formerly Jessica Cruz, and now Ms. Anita Fisher has joined us a few months ago. So really making sure that we have the consumer family member perspective. So really our goals and our purpose for existing, we really spend a lot of time, it's kind of like two buckets. It's prevention and intervention. I like to think that I spend a lot of my time thinking, but probably about 70% of my time thinking about prevention, but really recognizing that there are a significant number of individuals who have become involved in the justice system over the years. So really wanting to make sure that we are focusing on intervention to try to break those cycles. Similar to what our previous speaker, Director Clendenin, was saying, really wanting to break those cycles and get folks really in their communities successfully living and optimizing their life potential. So we focus on really improving outcomes for people for both, across the age span, so all the way from children and youth all the way through life into the adult and older adult groups. And again, like I said, really that prevention. And we've been doing a lot of work with the Department of State Hospitals, really trying to prevent their support their diversion efforts. So we've been able to provide some training and technical assistance, even with Council on State Governments. We have a really exciting project still underway with them this year to really help strengthen that across the state. as well as in those diversion counties, the DISH diversion program counties. So again, we really want to prevent that involvement. We want to look for ways to encourage folks to implement evidence-based practices and programs. We want to identify best practices, make sure everybody knows about those best practices, and just really promote information sharing. And ultimately, we really want to improve the behavioral health for those individuals who are let me minimize this, who have become involved in the system. So we at CCJBH, we hold quarterly full council meetings, and then we have two spin-off work groups. One is our juvenile justice work group, and then we have our diversion and reentry work group, and those groups meet every other month. And we also produce bi-monthly newsletters. So whatever the latest and greatest is, we're trying to get that out to everybody. And we are mandated to produce a report every year, our legislative report. I am happy to say we've just finished our draft of this current year report. It's really exciting and meaty, and we're going to be really excited to get it out to you all by the end of this year. And so we really talk, it's kind of a snapshot of all the work that we've done over the years, and with all of our project updates. But this year we'll also be including some data through our Medi-Cal utilization project. We have a project with through CDCR and DHCS for a data share looking at Medi-Cal utilization for people coming out of prison. So I'm going to be excited to share those findings this year. And just to give a sense of our project portfolio, we have quite a myriad of projects that we do, but one of them is this project to address housing needs and homelessness and high rates of homelessness of our behavioral health population who have justice needs, or behavioral health population who has become involved with the justice system. And that's really going to be a focus of our presentation today. So my predecessor, Stephanie Welch, who is now at the California Health and Human Services Agency as our Deputy Secretary for Behavioral Health, and also somebody I still work very closely with, started this work for our council. I was actually a council member at the time. And so we started getting into some of this housing policy work, and she started getting really excited about it and kind of diving headfirst into it, really recognizing that stable housing is just kind of like that Maslow's hierarchy of needs, those basic needs: food, clothing, and shelter. So making sure that, you know, those needs are met in order to, before we can expect successful outcomes for our diversion and reentry programs. And that recognizing also that it's very complex. So, you know, traditionally, our population has not been able to access and receive services from the various systems. And it's also, there's so many systems that are involved in supporting our population that it's really difficult for them to coordinate, and also difficult for our population to navigate through those systems. And it's even been made more difficult through COVID-19, you know, as people had been released from prisons and jails, particularly last year when the pandemic began. So we leveraged our unique position. So our position where we solely focus to, or exist to focus on the justice involved population with behavioral health needs, to really bring together our system partners to start thinking about how we can better support the needs of individuals who are justice system involved, and really wanting to look at, you know, subject matter expertise and available data to inform our path in this work. And so in September 2019, when Stephanie was here, she released a housing policy brief. So she did a work group in September, and then that culminated in a housing policy brief that was published in February 2020, and then also a housing first fact sheet. And those are available on our CCJBH website. And that kind of spurred into, or kind of evolved into additional work, and the project that we'll be talking about today, which is a partnership with the Council on State Governments Justice Center, which was funded by the Melville Charitable Trust, and culminated in the report that we'll be reviewing today, that on reducing homelessness for people with behavioral health needs leaving prisons and jails. And so I think with that, I'm going to turn it over to my colleagues. I think Hallie will be speaking next, just to kind of introduce the topic, and Katie will be chiming in thereafter. So without further ado, Hallie, if you'd like to take it away and walk us through this wonderful information that you guys have captured.
I'm Hallie Fader-Tao. I'm a program director at the Council of State Governments Justice Center. Despite my background, I'm actually in San Diego. We just have a number of sort of templates, but CSG is a national organization, and we're a nonprofit. We're a membership association for state governments, and we exist to distill research and practice for policymakers. Katie and I work at the Justice Center, which focuses on crime policy, and we work in the behavioral health division at the Justice Center. So our scope of work is really the intersection between behavioral health and criminal justice involvement. And our team has worked with NAMI for many years, starting with the Consensus Project report, Stepping Up initiative, Stepping Up work here in California, and are really excited to be working with CCJBH and other partners in California on this incredibly thorny question around reducing risk of homelessness for people with behavioral health needs who are leaving justice settings like prisons and jails. As Brenda mentioned, we started this work really thinking about, in order to serve this population, we need to be thinking about at least 3 areas of knowledge, whether, the criminology, criminal justice systems, those stakeholders, those data sets, those funding streams, then the complex world of behavioral health, both the mental health and substance use and co-occurring, what's happening at the state level, what's happening locally, and then, what works for people with different constellations of needs, and then bringing a third partner to the table with housing and homeless services. And for us, this is and I think for California, like for around the country, bringing this third partner is a relatively new thing, to ensure that the knowledge about what works to reduce homelessness, to keep people stably housed, is part of the policy and programmatic strategies that states and communities are putting together. So in order to ground the report that we're talking about, we tried to do our best to synthesize what we know nationally, as well as what we've learned in California, works at this intersection of criminal justice, behavioral health, and housing or homelessness. And as Katie is talking about our process, you'll hear how we were trying to bring together sort of what you find in the literature, what you find from talking to people who are doing this work, what you find from available data sets. And this was a big challenge, as it often is. In our state, it is not possible to know how many people leave jails and prisons who have behavioral health needs, who are at risk of homelessness. That sort of data is not collected right now. And yet we know that this is a population that needs a range of services, a range of supports, and in order for state policymakers to to assign resources appropriately, they need to know how many people they're talking about. So part of our exercise was really trying to put some numbers, some scale on this population. And finally, but of course critically important, is what this looks like from the perspective of people who have been through the criminal justice system and returning, trying to find housing, as well as their loved ones. And so the rest of our presentation, Katie's going to talk a little bit about how we went about putting the report together, what we found in terms of numbers, and then I'll talk a little bit about the recommendations that are included in the report, both for state policymakers as well as for localities. So with that, I'll turn it over to Katie.
Thank you, Hallie. So I'm Katie Herman. I'm a senior policy analyst here at the Council of State Governments Justice Center. I am in San Francisco. For for real, unlike Hallie. But I'm so happy to be here today and talk a bit more about this report. I also, I want this to be as engaging as possible, even though we're on Zoom. So right now I'm just going to put 2 questions in the chat that I really hope people would like to respond to in the chat. Maybe we can talk a bit about them at the end of the presentation, but we really want to hear from you, your experiences and thoughts about this work. Oh, can you just go back, Brenda? I'm sorry. So like Hallie mentioned, this report was developed with a lot of different pieces. We did, a literature review, a research review about best practices locally and nationally around housing for people with behavioral health needs who have criminal justice system involvement. We looked through as much data as we could find available, which we'll talk about in a second. And we did many interviews with state and local policymakers, researchers, people from CDCR, people from the BSCC, people from research institutions like UCSF has a lot of housing work going on right now. And also, as Hallie had mentioned, we really wanted to ground this work in the experiences of people with lived experiences in the criminal justice and behavioral health systems. Because of course, people with lived experience are the experts, and we really wanted to make sure that all of our recommendations aligned with people's experiences. So we interviewed some people that have participated in the Amity Foundation program, which provides a lot of reentry services throughout the state, and other people with lived experiences. We've also made sure that as we've been talking about this report in different settings and doing different presentations, that we also include speakers with lived experiences in the criminal justice and behavioral health systems. Some of the themes that came out of our interviews with people with lived experience, especially, and none of these are really surprising to us, but just that importance of needing a connection between a jail or a prison and the community. So meeting case managers, discharge planners, doing in-reach into the jails and prisons as much as possible so that someone isn't just released with no plan in place. Also, for people that were released to a program like Amity that does provide housing, just the importance of staff that are trauma informed. People talked about just needing to feel warmth and acceptance and have staff that were never going to give up on them, especially people that have been incarcerated for long periods of time and were being released back into the community. There's also discussion about people that are looking for more independent housing through like private landlords, in terms of policy changes, taking out questions about criminal backgrounds on renter applications. Some places have extra fees if they need to run a background check that the renter needs to pay. And also we had many people talk about, just getting the opportunity to tell their story to a landlord really made a lot of, it made a difference if they could really talk directly and explain their situation. Many landlords were then open to renting to them, even if something may have been flagged on a criminal background check. Also, in terms of developing new housing for this population, like a residence or something, just very concrete suggestion. I mean, no pun intended, concrete suggestions, but create facilities that don't look like institutions, because this is a population that has such a significant history of institution. Make simple things like making the walls colorful or have art on the walls, even things we heard, people have been incarcerated, especially really long periods of times, or been institutionalized, simple things like having access to a bathtub that they maybe haven't had for years and years, like having private bathrooms that have a bathtub can really make it big, make people feel much more at home and much more welcomed and help them on their recovery after leaving a setting like jail or prison. And another really big theme that came out of all our interviews was being able to use peer specialists in housing work, in behavioral health work, criminal justice work, just because, again, peers have that lived experience. They can be so helpful for people as they're leaving institutions. So really trying to use peer specialists as much as possible in all different settings, because that has a really high success and it's just the right thing to do. So next slide, please, Brenda. So again, Hallie already talked about this. We're going to talk about a little bit how difficult it is to assess how many people with behavioral health needs are in jail and prison in the state. What are the challenges, and then the recommendations. Next slide, please. So based on research that we were able to analyze in California, there is about between 17 and 39% of people in jail experience homelessness in the 30 days prior to their jail stay. And approximately 30% or more of the California jail population has a mental health need. That could be anything from adjustment disorder, anxiety disorder, all the way to a more serious mental illness like schizophrenia, bipolar disorder. Next slide, please. And then in terms of housing and service needs people leaving California jails, I mean, a major theme of this report was that everyone needs an individualized housing plan. Cookie cutter plans don't work for anyone, but especially this population. So really needing to figure out what do people need. So we determined that up to 10% of people in jail in California need ongoing housing assistance and intensive mental health services, maybe like an ACT team or a full service partnership type program, and usually like permanent supportive housing. And then another 8 to 16% may need ongoing housing assistance, but to a lesser degree. So they may need rental assistance or like a rapid rehousing service or a housing case manager and less intensive mental health services. So maybe, you know, they have a psychiatrist at a clinic they see once a month and a case manager, or they go to some kind of group treatment. It's really just reinforcing that just having there's such a range of mental health needs, even within the population of this group in jail and prison. Next slide, please. And then in terms of prison, so these are people that have been transferred from jail to prison. About 39% of people leaving prison on parole report some level of residential instability. And about 29% of people at least 29% of people in prison have been diagnosed with a serious mental illness. So that means, you know, schizophrenia, schizoaffective disorder, bipolar disorder, major depression, PTSD, which typically means that you need a pretty high level of treatment in the community. Next slide, please. And then, of course, you know, our report really highlights just the inequities in multiple domains that exist in this space. You know, in terms of homelessness, Black Californians represent 6% of the state population, yet 29% of those experiencing homelessness. You know, there's similar disparities and inequity in the criminal justice system. The incarceration rate for Black Californians is nearly 7 times higher than for white people and 2 times higher than Latinx populations. And again, same in terms of behavioral health, there's much higher rates of unmet mental health needs for Black and Latinx people than in the general population. So again, when we're thinking about recommendations, thinking about ways to address these inequities, as well as providing the right level of service and housing to people. Next slide. Great, and so, yes, with that, I'm gonna turn it over to Hallie again, who's gonna talk through the key challenges and the recommendations in our report.
Great, thanks, Katie. And I noticed the group has been pretty silent in the chat, so I'll remind you again that it's there. I'm curious to see whether the challenges that you have seen will resonate with the ones that I'm about to go over, and would be very interested if you have some that we didn't cover in our report. So there are a couple of high-level challenges that we heard, and those are the problems that we're trying to solve through some of the policy strategies. The first one, I don't think any of you will be surprised to hear that there is a sense of silos between across justice, health, housing, and those silos among people, among data sets, make it hard to create the sort of collaborations that are needed in order to serve people holistically, as Katie was talking about. Next slide, please. Also, lack of data. We can't right size the housing stock and the services without knowing how many people need what. As Katie mentioned, one of the big planks for this report is that need to individualize services and different types of housing support, whether it is a supportive housing situation, whether it's rental assistance. Different people need different things, and if we don't know how many people need what, it's challenging to create the right supply. Next slide, please. As Katie mentioned, and I'm sure this group has spoken about in other settings, that people with behavioral health needs involved with the criminal justice system who are facing housing insecurity are a group that are stigmatized in many ways. You can almost picture them facing at least 3 levels of stigma, you know, crazy criminals who are homeless, you know, I mean, there's a lot of negative stereotypes and beliefs about this population and the people who are in this group that create barriers for them to access housing that they need, whether it is on a case-by-case basis or whether it is as a policy, help not prioritizing this group that really does have an urgent need for care and support. Next slide, please. And now I'm going to knock everybody out of your chairs by saying that we have a affordable housing crisis statewide. And so, you know, there is not enough housing for all Californians, and for this segment of Californians who face so many obstacles to accessing housing, it is even harder. So in order to reduce homelessness for people who are leaving prisons and jails, we need more housing in the state. So these are the 4 challenges, next slide, please, that sort of undergird the themes of our recommendations, which are around improving data so that we have a better sense of how many people and what they need, improving access so that those people can be connected with treatment and housing and other social supports, and then obviously some of the longer term strategies for expanding the housing stock in the state. Next slide, please. I think I'm going to go through these pretty quickly because I think I've made these points already, that we need to know how many people need what in order to right size the supply. On an individual basis, we also need to collect data so that as I am booked into jail, somebody is collecting information about what my housing needs are, my treatment needs, so that information can be shared to inform my reentry planning so that those services and supports are available for me when I leave. Next slide, please. I think I'm actually going to skip the next 2 slides and move over to the slide that says all recommendations at a glance. So this is the recommendations portion of the paper. We have 10 recommendations stepping through those different challenges. and moving towards those goals of better information, better connections, and a more correct supply. So the recommendations themselves go into these groupings of facilitating cross-system collaboration, better identifying those who are at risk of homelessness, setting up processes so that they can access housing, setting up processes to assess housing needs prior to release, and then create the connections to the homelessness services system, and also using those improved data collection to quantify the amount of additional housing and services that are needed. Next slide, please. We also need to increase the resources that are available to meet immediate housing needs. And this is something I think Brenda is going to pick up in a moment, where we have unprecedented investments in addressing homelessness, in behavioral health. So how do we target those investments to serve the most people with the services and treatment that they need? Making, again, the support services that create those connections, prioritizing the target population so that there really is a pathway for, when housing stock is limited locally, there is still a chance that there is still a portion of that is set aside for people with behavioral health needs, including those leaving the justice system, so that they're not going to the end of the line at that moment where they're leaving a correctional institution and really do need that support. There's also a component of this that requires training for staff and policymakers, as well as obviously the development of new affordable housing stock. So you'll see in the report, which looks like this, these 10 recommendations in more detail and what county and state stakeholders can do to advance these recommendations. I think the other hidden gift in this report, I hope it is a gift, is the estimates on the different population components in terms of how many people are leaving jails, how many people are leaving CDCR with different needs profiles. We're really hopeful that these initial estimates and additional work that we're doing to refine them will be useful for policymakers, for advocates in putting a scale and a sense of size to this issue. So the report is available on our website. We can also put a link to it in the chat, and I will turn it over to Brenda on what happens next.
Thanks, Holly. Thanks so much, Katie. Great overview. I'm going to pop to the next slide. So again, like I was mentioning, this is just one more piece of just moving this project forward to keep working on this issue and working to ensure that there's housing available for our population. So in terms of our next steps with these report recommendations, we're looking to continue working with the council and state governments to really deep dive on all these recommendations that Hallie just walked us through. So really just to make sure folks are getting educated and really getting an understanding on what each of those recommendations are and kind of what can be done to address them. And all that just to kind of set a foundation or a stage to bring system partners together in a summit to come up with some real concrete plan on how to implement those recommendations. And then we're also exploring the development of some pilot projects. There's different counties that are interested in working to build out their local systems to address the needs of this population. So we're looking to hop on those opportunities to work collaboratively with our system partners to really expand that, leveraging all the wonderful investments that are being made available now through funding. Also, we've been working really closely with the Homeless Coordinating and Financing Council, who had published their action plan. So They've done a larger kind of overarching action plan for the state on how to address housing needs and homelessness. And we are listed in that report under the activities prioritized for implementation, with this report looking to continue thinking about how we can implement the recommendations in this in the report that Hallie and Katie just reviewed. CCJBH has also been working with our different system partners. We work with Housing and Community Development on really getting the word out on the rental assistance program, which is called Housing is Key, still available. And Housing is Key is a program that through the pandemic is helping folks who have gotten behind on rent and some other utilities to be able to help make folks whole on that as much as possible. And so really excited that we were able to partner with Housing and Community Development on that to get linkages out to the Division of Adult Parole Operations, probation, so county probation, and then also our Medi-Cal partners, just really getting that word out of the availability of this program so that folks could apply. And then, again, continuing to collaborate with our system partners. So at the state level, that's with Housing and Community Development, Homeless Coordinating and Financing Council, which I believe is having a name change soon. It's going to be the California Interagency Council on Homelessness or something like that. But I know they're changing their name to come in line with the federal partners. As well as social services and the Department of Healthcare Services. So really just trying to stay coordinated at the state level, kind of modeling that so it'll be helpful for at the local level. And really thinking about, since there's different ways in which systems are structured, a lot of the federal funding goes directly to the local system. So how can we kind of get in on those conversations and help with that planning? And then we also have our partners at the Board of State and Community Corrections who have their adult reentry grants. So really trying to stay in sync with that as well, so that we're all sharing information and sharing our lessons learned, so we can really advance the ball on this issue. And so we thought we'd stick in the PowerPoint. There's the Homeless Coordinating Financing Council put together. It's a very large document, but it's a nice compilation of all the funding sources that are available, both at the state and the federal level to prevent and homelessness. So that guide is now made available online. And then just a couple that aren't in that guide yet, but I probably will be in the next iteration, is that the Department of Healthcare Services has their CalAIM initiative, which is California Advancing and Innovating Medi-Cal, which includes a new benefit. It was called In Lieu of Services, but I believe it has had a name change too to community supports. And the community supports benefit for those managed care plans that opt in, which quite a few are planning to opt in, would include services such as housing transition, navigation services, housing deposits, and housing tenancy and sustaining services. And then there's also the Department of Healthcare Services Home and Community-Based Services Spending Plan, which also includes funding that would help support our population, or address the housing needs of our population. So with that, lots of exciting work on the horizon, so much work to be done. We've really been fortunate to have our different partnerships at the state and local levels. I will say we have our full council meeting coming up, so I want to put a plug for that. DHCS will be doing an overview of their CalAIM proposals, their justice involved proposals for the CalAIM initiative for us. So it'll be a nice kind of real quick place to get schooled up on that for our justice system proposals if you haven't become familiar with those already. And they'll talk about some of their other investments like that home and community-based services spending plan as well as probably the behavioral health continuum infrastructure grants. I believe Director Clendenin also mentioned those investments in her presentation. So DHCS will be talking about those with us as well. And then the Federal Interagency Council on Homelessness is having an open public comment period on their strategic plan or their plan. And so not on this guide or on this slide because we haven't quite solidified it yet, but I'll just at least put it on everybody's radars that like in early November, we're looking to do a listening session with our CCJBH stakeholders. So if you're interested in that, please hop on our website. If you go on our listserv, you can sign up to be on our listserv to get our announcements. We'll get that information out if you're interested in providing feedback for us, because we want to provide some input on that federal plan, their federal plan to end homelessness. And so we'll be hosting a listening session as well, just to gather whatever ideas and thoughts folks have for influencing federal level planning in this space as well. So on this slide also, we have our listserv. If you go to our CCJBH website, you can go ahead and click on to join our listserv, or you can email us at ccjbh@cdcr.ca.gov, and we'll get you on that list, our distribution list. So with that, I think that concludes our presentation, and we can open up for questions.
Thank you so much, Brenda and Hallie and Kristen, or Katie. I don't know where Kristen came from. I'm so sorry, for all of the information. I know that we had some folks sharing some comments here in the chat box. I invite any of you who may still have questions that haven't been covered or answered to go ahead and pop those into the chat. Let me scroll through here. There is a link to the report that Hallie shared with everyone. So, and we'll pull this down and make this available with the materials that we'll have shared after the session today as well. So if you don't get a chance to grab that, we'll go ahead and make sure that that's available with the slides from our presentations. So let's see here. So we do have one question. What are people who have a mental illness to do if they are being denied housing because of a felony on their record?
I mean, I can try to answer. I mean, it's such a hard question. And that's really, one of the huge barriers, like we talked about in the report, is that stigma, and then people not being given the opportunity sometimes to even apply for housing given their criminal record. I mean, like I mentioned, some of what we heard from people we interviewed is that if you have the opportunity, like speak directly to the landlord, of course, if you're comfortable, giving some background, explaining kind of the circumstances of, a person's incarceration, but how, you're really moving forward. Some of the people we talked to said that really made a big difference, kind of having that human connection, and that even with, criminal record, landlords were able to somehow, they were able to still offer housing. I don't know, Hallie or Brenda, if you have more like concrete.
No, I think that's a lot of oh, sorry, go ahead, Hallie.
I was just going to say, I think, Katie talked well about what can happen in an individual case. I think the other thing I would add there is just if there's a way of demonstrating secure income, so that, so to just try to understand what the landlord might be concerned about. Is it that they're not confident that rent will be paid? Is it a concern about the criminal history? At a policy level, there is certainly work being done to remove barriers to housing for people with criminal justice experiences. The Vera Institute of Justice is working with a number of public housing authorities to take those restrictions away. And then also a number of communities are partnering with housing providers or with funding streams from the county level or from the county level to demonstrate to landlords that there is security in terms of these tenants. So I think, at the local level, whether it's at the county level or the municipal level, there is work that can be done to ensure that policies don't unnecessarily create barriers. And then programmatically, are there ways that individuals can be supported by local programs, either in terms of help in terms of creating comfort for landlords, both in terms of safety and the security of the investment. Brenda, more things?
Yeah, just, kind of echoing those ideas and just really saying that that's a lot of the conversations that we're looking to have is, how can we use education, like our webinars coming up that we're looking to do to start educating folks, our different system partners, and particularly the housing system partners, to better understand our population and our needs of our population, and, just getting them, empowering them to know how best to serve our population, and being able to share those strategies that have been, shown to be successful and effective. And so really trying to get that word out and help and provide, technical assistance to build out that infrastructure. And I think that's the work we're looking to do kind of in these out years, to really foster that and just make this the new normal, this part of the system.
Yeah, Brenda, what you hit on also reminds me of another aspect to the work, which is addressing community concerns about having housing for this population locally, which might be called nimism, and what can be done in a broader way to educate communities as well, so that they're not objecting to new housing being created or to programs being placed.
Wonderful, thank you. I don't have any other questions coming up in here. So I just want to say thank you to everyone who's joined us today. Thank you to our presenters, Katie, Brenda, and Hallie, for all the information that you shared. And just as a reminder, as Harold shared with everyone, these sessions are all being recorded. We'll have the videos as well as the materials shared today available for folks at the conclusion of the conference. We have a pretty packed agenda for the next couple of days, and so you can get access, as you did for these sessions here today, through the Whova app. We are going into our lunch break now, so we'll have a 30-minute break, and our afternoon session will begin with our keynote at 12:30, followed by our afternoon sessions, all available in the agenda section of the Whova platform. If you have any questions, we have a whole team here at NAMI California for support, backup, navigating the site, whatever it may be. And so with that, thank you all for joining us on the session today. Thank you to our presenters. Thank you to our board and our team working in the background to support this. And we will see you all this afternoon. Enjoy your lunch.
Thank you so much, everybody.